There we go. Seeing everybody flying in. I love that. Is that you? I see you there. Hello, Juliana. Nice to see you
Hello,
back here
hello.
again. Hi, Karen. I see you there. Great.
Mhm.
Great.
Hold on.
Pat, I see you there. Hello. Welcome to day two. This is really wonderful. We'll just be letting people in as they arrive. We do ask that this is a camera on event so that we can create as much safety and trust in the room as possible. It's the sensitive subject matter that we're discussing. And the more that we can see people, then we're able to create that safety in the room. So if you are in a place where it is safe for you to turn on your camera, we would ask that you do turn your camera on. Sonia, I see you there. Hello. All right. So what do we have in the house today? Pop in the chat where you are from, because we have some people who are here yesterday and some people who are new. So just pop your place in the chat there. Brampton, Ontario, Canada. I am also a fellow Canadian.
Oh, we have to do this again.
Jacksonville, Florida. Amazing. Clarksville, Tennessee, Pennsylvania, Lethbridge, Scarborough. Amazing. You lovely with your Zoom username. I'm going to ask you if you can rename yourself so that we can see everybody, and then we can make sure we're getting an accurate assessment of who's here, especially useful for the prizes. Yeah, which we'll be going over in a little bit. So before we begin, I'm going to give a land acknowledgement I'm in the South Okanagan, which is the Seal people. And I am ever so grateful that I get to live and be here and be a part of this unceded territory. And I love to set the intention for a positive co-creative future so that we can all get what we need, no matter whether we are plant, animal, water, human, the whole shebang. Everybody gets what they need so that we can, all of us, create a sustainable future together. Now, for those of you who were here yesterday, I am curious, is there any aha moments that you had yesterday that you would like to share? Any takeaways that were impactful for you? I really value an interactive learning environment. So if there's something that you were like, oh, this was a good takeaway, I would love to hear from you. Colette, let's hear from you.
I was really, really encouraged by hearing all the really hands-on practical ideas about how to have the conversations, because I'm a big believer in a lot of conversation. And because of that, I think that can create, like, as soon as you know how to have the language, how to ask the right questions, then your client is empowered to make the choices that are right for them, and you're educating them so that they know how to advocate for themselves, and you can be a cheerleader as they learn to do so. Because for a lot of people, especially in trauma-informed care, there's a lot of shame around self-advocacy, and as soon as you have a moment of empowerment, you have 3 steps back. And a massage therapist is one of those only points of contact in the healthcare system that is able to see that happening and still be that constant and safe presence for them. And so that was a really important thing for me. I have a psych degree, and I really focus. I used to actually be like an anti-queer activist. I was part of a very small culty religious community, and now I have since learned and I have since grown, and now I am a huge believer in creating queer affirming care for absolutely everybody. And I've come out myself, and it's been quite a journey, but I'm really grateful to be here. So thank you so much, Erin.
Yeah, my pleasure. Thank you. It sounds like that's been quite a journey that you've been on. And Yeah, and for you to make such a radical transformation within yourself from, I'm guessing, what your early childhood experiences showed you, or wherever you ended up in that very kind of nano micro cult, and then ended up, embracing yourself and being able to offer safe spaces for people and language around care and accessing. I mean, that's a huge journey. So ever so grateful that A, you're doing that, and B, you found that in the event yesterday. So thank you very much for that share. I appreciate that. Amazing. Juliana, let's get you up here.
I really just want to point out that I really loved when you said it's a psychosocial spiritual model of care. I loved that you put that the spiritual aspect of it also into it, because I'm very much a spiritual person as well, and I see things at a different level of the being, right? So it's nice that you put that in there. Yeah.
Amazing. Yeah, thank you. And
Thank
I
you.
think that's science really making advancements, because previously they just didn't count the spiritual aspect of life. They just thought, well, we just need to cut it off, and anything that's physical, we'll stop there. Anything that's not, we're going to just relegate that to the sidelines. And then they realized, oh, that's actually incomplete, because humans are bigger than just their physicality, and there's a lot more components that go into it. And I think with this work, you cannot be divorced from the human spirit. You absolutely come in contact with the human spirit. And so having that knowledge of the spiritual dimensions is really important. Yeah. Thank you very much for bringing that up. So just checking into the chat here. Catherine says she agrees it is about creating integrative support. Yeah, integrative support is so important, because we need to be blending what the medical system is bringing with what the alternative allied professionals are bringing. And if we can bring the best of both worlds together, we can really create some pretty profound change for people that's not available in any other way. Yeah. Okay, groovy. Well, let's dive into science, because today is all about science. Now, I'm going to share with you my relationship with science. So, I was not a science lover when I was in my younger years. I'm not going to lie, I am by nature an artist, a mystic, a visionary, a creative, and, kind of out of the box kind of gal. And so when I came across science in high school, I was like, oh, I hate this. And I got out of it as soon as I humanly could. So I was out of science before grade 12. And I thought, I'm never touching it again, ever. And then I got into massage school, and I was like, oh my gosh, okay, this is all science based. I've got to go into different kinds of biology, molecular biology, organic chemistry. I had to learn like all the different aspects, all the different systems of the body. I went to school at WCCMT in New Westminster, which at the time was the most intensive massage therapy program on the planet, 3,000 hours. And it was very science based. There was no woo in that course at all. And I felt like I was going to throw my textbook through the wall on my first term. And I waited out in the hallway one time. I was like, I have to leave the room because I need someone to rescue me. And I sat out in the hallway and I was like, Erin, no one is coming to rescue you. You're just going to have to come to terms with this. And, I was like, okay, I can do this. I can do this. And what I started doing was pre-reading what we were going to be doing that day before the class happened. So then when the class happened, I had an overview of what was going on. And then I reviewed afterwards. So I got every class, I got three times worth of learning the information. And what I found was a different part of my brain started waking up than I had ever had access to before. And I realized, oh, actually, I love science. This is so interesting. And I got into research, and I loved our case study, because we got to, I tested out fascial work, and I was really specific with what I was doing and all the measurements and all of that. And, and then I got into practice and I started working with this clientele. I looked for courses when I first started working with this clientele, because I was like, I don't know what I'm doing. I need someone to show me, but there wasn't any classes. And thankfully, I'm an Aries and I'm a very self-starter kind of person. Plus, I have courage. So I was like, I'm just going to figure this out. I'm going to go forward. There's nothing out there in the world for me to call on. So I got to call on myself. So I just started researching. Someone would come in and they'd be like, I had a DF flap. And I was like, okay, let's go and figure out what does that actually mean. And I started doing so much deep diving. And then when I actually started teaching other people what I'd been doing for years on my own, then I really took the deep dive. And if you're going to get your courses accredited, which are my courses are accredited across Canada, we're in the process of getting them accredited in the United States, Australia, and New Zealand. If you're going to get your courses accredited, they have to be evidence informed. And I have lost hours. I swear, I've actually lost months of my life down the research rabbit hole because there's just so much to discover. And massage therapy is brand new to research compared to other, like surgery's been doing research forever. Physios have been doing research forever. Osteo's been doing research forever. Massage, not so much. We're like 30 years maybe. So we borrow a lot of research from other people, which is fine. And then we adapt it and we're figuring out all the time, is massage working the way that we think that it is? And we're actually finding no, often it works differently than what we thought. So science is an ever-changing landscape, and you can get attached to an idea because it seems like, oh, that's been proven. And sometimes it continues to get proven. But there's other times where we think, oh, this is the way it is. And then it turns out, actually, that's not what we thought. And, 5 years later, 10 years later, they're like, oh, actually, that's totally not the case at all. So you can't get too attached to scientific ideas because it is a landscape of asking questions. It's a landscape of exploration, and it's a landscape that's constantly changing. So what we're showing is our understanding to date, and then we'll get on, greater understandings, deeper levels of knowledge as the years go on. There's a question here from Colette. Have you had the chance to do any research yourself in massage therapy specifically? I personally have not, but it's one of my dreams. But I have recently been invited by a PhD student at Simon Fraser University to participate in research around trauma-informed care for breast cancer patients. I know, it's like, oh, it's so exciting. So I will be participating in that, which is really cool. So today we are covering all about science. And I'm going to share my slide. Oh, but before we do, I'm just going to do a super quick recap about what we went over yesterday, because we have, oops, that's the wrong thing. I meant to share my screen. We have already covered a ton of information. So yesterday was all about you, why you matter in this work. So we understood the bigger picture, some stats, how many people are getting diagnosed, the post-op complication rate, how widespread breast and chest surgery is between elective breast cancer and gender affirmation surgery. We went into your big why for treating breast patients. And I really want to acknowledge some people for their shares and the care that you put in the Facebook group. So Comfort, thank you. Natasha, Kelly, Elise, Catherine, Amanda, Stacy, Sonia, Allison, Angela, Pam, Lou, Pamela, Monica, Rebecca, and Michelle. Thank you so much for putting your shares into the Facebook group. And if any of you want to do it afterwards, you haven't done it yet, please do. It is a safe environment, and it's really interesting to know why people get into this line of work. We went over an exercise for pressure and tension in your hands. We covered trauma-informed care and 6 blocks to treating breast patients. So today we are getting into science. What does science say? Because as I said yesterday, I really believe in blending science and the art of massage together, and that's how you get the greatest treatments. So today we're going to be covering the history of mastectomy surgery and breast anatomy. We are also going into 3 types of breast and chest surgery, 4 areas of post-op management, and also the science of mentorship, because it's really interesting to know what science says on mentorship. We also have prizes for everybody who's showing up live, doing all the share activities, and liking and commenting on other people's posts. So just reiterating what those are. You get a 1-hour coaching session with me as first prize, which is a $250 value. The second prize is 6 months of the treatment library. If you sign up for the academy, then after the academy is over, you can continue your access to the library instead of moving on to a subscription service. And then the third prize are these breast surgery cue cards so that you have an understanding, an overview of 18 different types of breast and chest surgery and some information about breast cancer and oncology treatments. So really good, interesting value there as well. And our share from today, which I'm just gonna, you don't have to do it right now, I'm just letting you know that the shares for today are 2 gems. If you pick up a gem and you feel like, oh, that was like a little gem I could pick up and put in my pocket. First gem is something on what science says. And the second gem are year goals and gaps to fill for yourself. So I'm excited to hear about what you get jazzed about with science. And also I want to know, what are your year goals? And if you have any gaps, what are they? And see if we can help you fill them. Okay, so let's go into the history of mastectomy surgery. Now, I think this is really interesting. I'm not naturally a history person, I'm a futurist, but I still think looking back sometimes is super, super valuable. And on the nature of this surgery, it's a pretty interesting history, I think. So the first mention of surgery is Egypt, 3000 BCE, which is almost 5,000 years ago now. And what they did at that time was simple cauterization of the tumor. So pop a yes in the chat if you know what cauterization is. Cauterization of the tumor. So cauterization is like a burning. Basically, you're burning the tumor. You're taking heat to it and you're trying to stop the growth of the tumor because you are burning it. And that was their first attempt at dealing with breast cancer. And it pretty much stayed that way until we get into Europe in the 1700s. And at this point, they started taking a much more radical approach. And here they began removing the entire breast, pectoralis major, and lymph nodes. There was no anesthesia at this time. There was no infection control. There was no reconstructive options. And as you can imagine, mortality rates were very high. So women went in and they took this entire chest structure off their chest with no anesthesia. Maybe they got some brandy or something, but basically they were awake and alert through the whole thing. So if you think about generational trauma, this would count for sure. Thankfully, in Japan, in the 1820s, the very first surgery ever done under general anesthesia was a mastectomy. So finally, in the 1800s, we got a little bit more humane in our approach. Doesn't necessarily mean it traveled to other parts of the world, but in Japan, they did start performing surgeries under general anesthesia, and a mastectomy was the first one. This is an old medical illustration, the USA in the 1800s. Now, I have various different reactions to this image, and I want you to pop a word in the chat that outlines your reaction to this image. What's your original thought? Yikes. Yeah. So this is something, yeah, OMG. Too many hands in the pot, sad, terror, horrific, OMG. Yeah, I mean, this is a lot. So yes, her face, thank you. I recognize that as well. So this is something that's really interesting. Now, this woman is not under general anesthesia. She is awake. She's fully aware of what's happening, and she's looking the other way. Her eyes are open. These gloves, these hands do not have gloves on them. USA in the 1800s, there was no germ theory. Germ theory wasn't even discovered until the late 1800s. So these hands probably were unwashed. Chances of mortality with this are super high. Now, I want to give a shout out to the strength of women. And this is one of the things that I just find so incredible about women. Often women's strength is in the capacity to endure really hard things over a long period of time. We can just keep going and we can endure an unbelievable amount. And that's what this woman's face looks like to me. It's just this incredible endurance of like, I will get through this. However, I have to ask the question, just because we can endure doesn't mean we have to endure. Doesn't mean we need to go through things like this. And I think the answer is no. Unfortunately, the world agreed because they decided, okay, we have to start improving our methods. It wasn't right away, but they did start improving methods. And now they're getting more and more humane as time goes on, which is great. Zoe says the diagonal cut goes way back. I wonder how that came about. Well, we'll show you a picture of how much they actually open the chest to do mastectomy surgery a little bit later on. And it's a big hole that they create. It's not small. The scar is only the tip of the iceberg. So in the 1890s, the Halsted's radical mastectomy became the standard of care, and it stayed the standard of care for the next 70 years, which I think is incredible. So they took out the breast, the pec major, the axillary lymph nodes, fascia of rectus abdominis, serratus anterior, subscap, lat, teres major, all of them were removed. Like the whole thing was vacuumed out. So this again, this is another early medical image that was used for the doctors. And you can see her eyes are open. Her eyes are open. Fortunately, at this part, they put a cloth over her face so that, you know, she wasn't completely staring them in the face. But this is no joke. Like this is a lot of this is a lot for a person to go through. And all these muscles, they don't take out this amount at this day, which is great. Nancy asked, how did they discover the cancer back then? Probably it was very palpable at that point. They didn't have any internal imaging, so it was probably a very large lump that was felt on the breast, and they could tell like this is not supposed to be there. So it had to be large enough for a hand to be able to palpate. Now, in the 70s, we started making some real advancements and things speed up after the 70s. So in the 70s, we discovered a lumpectomy, which means you're only taking a portion of the breast tissue. You're not taking the entire breast. And they realized, okay, we don't actually have to remove all of this. If we just take a portion and then we couple it with radiation, then the woman's got a pretty good chance of survival rates. So that became a lot more common. And to this day, if someone gets a lumpectomy, it's mostly coupled with radiation. It's still the standard of care. Also in the 70s was a great time of discovery and openness in society. The first autologous flap surgery was performed. Now, just pop a yes in the chat if you know what an autologous flap surgery is. Just pop a yes in the chat if you know, or no if you don't. Yes, no, no, yes, yes. So a little bit of a mixed bag. So an autologous flap surgery means that a person is using their own body to recreate the breast. So in this situation, they started with a lat flap, which means they take the latissimus dorsi muscle on the side of your back and they pull it through your axillary area and they use it to recreate the breast. So that was the first flap surgery done in the 70s. In the 80s, early 80s, they started with abdominal flap surgery. So that little, tummy pouch that women have underneath their belly buttons. They took that and then used that to recreate the breast. And that's still happening today. In the early 90s, we got our first skin sparing mastectomy, which means they realized, oh, we don't have to take everything off. We can just hollow out the globe of the breast so that it's just the skin on the outside. And then we can put an implant in, and that's less invasive for the woman's body because the implant can just sit in the natural pouch of the breast, usually underneath the pec major muscle. And it's less invasive for the woman. Now, current standards of care is a multidisciplinary approach. So they'll use oncology, they'll use radiation, they'll use traditional medical methods, also working with some other options, sometimes like physio or occupational therapy, not very often in North America. But what they have found is when they take a multidisciplinary approach, the survival rates are much higher. So now the 5-year survival rates are 89%, which is amazing because in the 40s, they were 25%. So we have gone up a ton in the amount of knowledge that we have, the invasiveness of the surgeries, and the survival rates have gone up substantially as well. So just pop a yes in the chat if that's moving for you, if that's an interesting history. I mean, women have gone through a lot over all the years, and knowing what, our generational history is, I think is really important, because part of what we can do is help heal that trauma that people are carrying in their body, whether it's from this life or generations before. If we're offering non-judgmental care, it can go a long way towards releasing emotions from the body, helping people overcome very difficult states. And if you feel called to do that, just pop a yes in the chat. If you feel like, I want to be a part of the solution so that people are not suffering in ways that they are currently suffering because they don't have access to the standards of care that would help them get out of chronic pain and movement restrictions. Yeah, definitely want to be a part of the solution. So let's get into some breast anatomy. But before we do that, I'm just going to open up my program here. I just want to know, what are your comments and thoughts from that history? How does that influence your perceptions of what you are doing? Just pop your hand up if you want to put your voice into the circle. Okay, Juliana, let's get you up here.
Yeah, you've been talking about generational trauma and female, and this has been a month of it. I have actually been thinking of it and all the women's rights, but it's so interesting that you're bringing actually the health part of it. Most of the time you think of financial and voting, but the health as well. Very interesting history, very touching as well, and very amazing to put that out there. Yeah.
Yeah, amazing. Yeah, it really is very influential for how people are able to the changes that we go through as we're making our advancements. And yeah, it's really something. Thank you for that share. Yeah. Okay. So Becca says, wow, scary to know what was available to our mothers and grandmothers compared to ours. Yeah, absolutely. And this was something that people didn't really talk about. It wasn't really a thing that people felt comfortable creating any kind of conversation around. So it was very hush hush because it was, breath, private part of the body, can't talk about it. And, people really just continued to have this relationship with this part of the body that it was like, oh no, don't talk about that. Don't create, uncomfortability with anyone who is going through this. Just give them their privacy. don't invade them. And so people would go through these massive experiences without anyone really there to share with them, you know, what was going on. And part of what our mandate is, I think, as massage therapist, is to create the change that allows that conversation to happen so people don't feel isolated anymore. People don't feel like they're strange for wanting to talk about their experience. And you might actually run across people who have some of the more invasive styles of mastectomy. If you had someone with the mastectomy 40 years ago, chances of, you know, one of my students, she said for her mother, it was like they took a vacuum into their chest and just vacuumed everything out. And her mother had to live with this, you know, severe dysfunction afterwards because so many structures were removed. And you may come across people who have that very severe types of surgeries. They're still severe, I'm not going to lie, but they are getting less and less invasive as we go on, which I'm so grateful for. Okay, so let's go into a little bit of anatomy. So first of all, when we're thinking about the general composition, it is fibrous and fatty tissues, milk glands, and ducts. That's sort of, you know, the big kahunas of the breast. No pun intended there. But that's like, you know, it's a variety of soft tissues. Breasts really fundamentally are designed to feed babies as well as other things. So they have a lot of milk glands and ducts. The glandular tissue is very fragile and it's easily damaged. So if you use a lot of pressure on the breast, you may actually end up damaging the glandular tissue, which you're not intending to. You're just not aware that it's actually very fragile. So you have to be gentle with breast tissue. It does have extensive lymphatics, and the lymphatics primarily drain laterally. They do drain medially as well. They cover the whole of the breast. The lymphatic flow goes around to the back of the body and then up the nodes on either side of the spine. But their primary area that they drain is to the axilla and then up here towards the subclavian area and then back down in through the circulatory system here. And then it's excreted out of the body or sort of returned to the circulatory system. Blood supplies, it's very extensively supplied with blood. And interestingly, a lot of the arterial blood is really early off the heart. After the lungs, it's the first area to be receiving blood in the body, excluding the head. But if you're thinking about the trunk, the lungs get the first blood from the heart, and then the second is the breast. And the reason for that is because these are important glands. These are important structures in the human body. They help regenerate the next generation. They help keep the next generation alive. They create the instinct for mating, for beauty, for connection. And their symbolism is all around love and nurturing and care. So nature was like, we need to make sure these organs have the best options available. So they gave extensive lymphatics so they can be nice and clean, extensive arteries and veins with some of the most oxygenated blood in the body. And then the blood supply comes mainly medially. It does come laterally. It's not that it doesn't come laterally, but more blood comes medially. And then when you're leaving the breast, more blood leaves on the medial side as well. So blood supply, you get more activity medially. Lymphatic supply, you get more activity laterally. In terms of innervation, it's really from the spinal nerves. Now, here's a question. Pop yes in the chat. Do the breasts have, or maybe I should ask, what type of nerves does the breast tissue have? Motor nerves or sensory nerves? What type of nerves? Just pop it in the chat. What type of nerves do the breasts have? Motor or sensory? So here is both sensory, both. So the breasts actually have sensory nerves because they don't have motor tissue. Pec major is not considered part of breast tissue. So pec major does have motor nerves, but the breasts actually only have sensory nerves, and they mostly come from the spinal nerves at the corresponding levels. So they either wrap around the rib cage and then to the globe of the breast, or they come from the medial side and then out to the medial side of the breast. And there's a little bit of nerves that come from superior, but really most of them wrap around from the ribs. And then also the ligaments, these are highly influential, that come down on either side of the sternum, around the clavicle, where the coracoid and the clavicle meet, the GH joint. All these ligaments are extremely influential. So if you're going to be doing breast work, especially post-surgical, you need to pay attention to all these structures and don't forget the ligaments. Now, how many of you have ligament work, joint mobilization work in your practice as kind of a normal thing? Just pop a yes or a no, and there's no right answer to here. Everybody does different focuses with their practice. Is there anyone who doesn't really do joint mobilizations or ligamentous work as a part of your practice? Yeah. Yeah. So a lot of people do, a few people don't. So it's it's a little bit of a mixed bag of tricks, but you definitely want to pay attention to ligaments. If it's not a part of your practice, then it's something that you want to consider bringing in. So this is just a side view here. And this is just showing you here, these are the milk ducts, and then they go to the sinuses, which then allow the milk to come out the nipple. But what I really want to point your attention to here are these little white lines that go all the way through. Who knows what these lines are that go all the way through the breast tissue like this? They kind of weave their way all the way through. Just pop your word in the chat if you know what all of these white lines are here. So those are ligaments. Those are called suspensory ligaments, and that's what helps create this form, this kind of teardrop shape of the breast. So if someone is getting a breast lift, what we used to think about back in the day was you'd have these ligaments that were kind of like a belt strap that came down from your upper chest or clavicle, and you sort of shorten the ligament like you're shortening your suspenders, and then that would pull the breast up. But what we know now is that the suspensory ligaments are actually extensions of the fascia of the chest wall, and they're so interwoven through the breast tissue, you can't actually shorten them. So when they're doing a breast lift, they're doing different work, but they're not like shortening the little suspender strap, which is what we used to think of back in the day. So this is another picture here of breast lymphatics. You can see it's all around the breast here and going up towards the axillary region. These are some of the sensory nerves coming out from the medial section and the lateral section. So there's a lot of different blood vessels. This is a good view here coming right off the heart. You can see that these perforator arteries here, they just come right off of this artery here, right close to the heart. So I'm going to jump ahead to some of these muscles. So pec major muscle here, this is a hugely implicated muscle. You have to work with pec major if you're going to be doing breast and chest work, especially post-op breast and chest work. Diaphragm, this is a hugely implicated muscle, and intercostals in between all the ribs. And there's other ones, but we can get more into it. But those are some of your starting places so that you have a good sense of what it is that, like all the different structures that are actually being created in the body. So yeah, let me know your thoughts. Where are you at with your anatomy overview here? How many of you are like, oh, I'm so on top of anatomy, I know all of that? How many of you are like, see, anatomy overviews are always a good thing? No shame. I mean, anatomy is one of those things that, if you don't use it, you lose it. And all of us you know, we learned a ton while we were in school, and then you're out, and if you don't use it all the time, it can be a little rusty, and you're like, where was that structure again? What was that called? So yeah. Yeah, I love anatomy as well. So interesting. It does require a lot of review. Absolutely. Yeah, back to basics. It does help. And this is one of the things that I want to impress upon you. This type of work, it doesn't have to be super fancy dancy. It can be very simple work, but it can have very profound effects, especially when it's coupled with mindfulness. And tomorrow we're going to go into some mindfulness exercises. And today we're going to go a little bit into the science of mindfulness as well, so that you have some of the understanding about what that is all about. All right. So before we get into our surgeries, let's just take a moment to get up and stretch, move your body a little bit. I don't like people to be sitting too long in any of my courses. I like you to be able to move, get the blood flow back to your brain, feel revitalized. Take a sip of water if you want, or your favorite beverage, whatever you've got there. No judgment if you've got wine. It is 6 o'clock Pacific, which means if you're anywhere going east, you're definitely in the time where a glass of wine is a-okay. All right, let's talk about a mastectomy. Now, mastectomy is the most common type of surgery relating to breast cancer. And this is often kind of a base surgery, and then they'll do some kind of reconstruction on top of that. So what they're doing is they are taking the breast tissue and whichever related substructures they feel like are related, and it's due to a mortal illness. This is not like the gender affirmation surgeries where people are like, I'm growing breast tissue. This is not right for me. I have to get rid of it. This is like your breast actually could take your life. And so you're going to need to make a very difficult decision to either lose your breast or lose your life. And in the short term, most people are like, I'll lose my breast. Thank you. I'll keep my life. I don't want to lose my breast, but if that's what I have to do to stay alive, I will do it. However, because survival rates are now so high, like 90, 89, 90%, there's a lot of time afterwards now to live with that decision. And because the standard of care in North America anyway is mostly you're just sent home from hospital and left to figure out how do you actually heal from this surgery, very common to have extensive chronic pain, to have body dysmorphia where you feel like I can't stand my body. Often people feel like they've got a stranger between their shoulders and their abdomen or their hips or their legs, depending on how extensive the surgery was. And I mean, you can see like this is a lot that's been opened up in a person's body. Movement issues are quite common, so we can help with all of those things. So these are the retractors here that are pulling the skin back. And this is actually not an exaggeration of how big a space is created on the person's body. This is pectoralis major, which has been cut. And then this is a bit of the external oblique muscle. This is serratus anterior. This is a whole host of blood vessels and nerves that are coming down the side of the body. And they do all this opening. They may take out lymph nodes in the axillary area, and then they just fill them up with this nice little discrete scar. And they're like, oh, this is all that happened. But really, this whole area underneath has been attended to. And when they're going in and they're doing the surgeries, they dehydrate everything, they cauterize, they dry it out, because surgeons actually don't like blood. Surgeons are like, we do not want bloody surgeries. If you think back in the day, they used to have to put a bucket underneath the table so they could catch all the blood, and it would be splashing on their shoes and on their trouser legs. And they were like, this has got to go. We got to improve our systems here, so we're not dealing with this much blood. So now they try and do everything possible to have bloodless surgeries, which means they need to dry everything out. They need to cauterize everything as much as possible So what do you think that does to the tissues when they put the skin back afterwards? What do you think is a ramification? Yeah, scarring, absolutely. What do you think happens to all these surrounding tissues that were opened up and now they're lying flat on this very dry tissue? Yeah, adhesions, fibrosis. So all of this is an area that needs to be attended to as well, not just the scar itself. So we do have a picture of an actual surgery. And this is a simple mastectomy. So this is those retractors, and they pulled the skin right back from the side of the body. So this is serratus anterior. This is pec major. You can see the striations of the muscles here. And then this is the flap of the top of the breast. And you can see how kind of squishy all the subcutaneous tissue is in here. And this is after it's all been dried out. So we actually watch surgical videos in my program. So you actually see what's happening during the surgeries, because I think it's a way better idea of what the inside of the body actually looks like. Have any of you ever done cadaver dissections? Pop a yes in the chat if you've ever done cadaver work in a cadaver lab. Yeah, super interesting. But quite different than a living body, because it's all dead tissue and it's got different kinds of fluids in there to help preserve it. And often they are elderly people that are, they've donated their body to science, and that's only a very small segment of the population. But when you're watching surgical videos, you get to see what a live body actually looks like. And it is very fluid. It's got a lot of juiciness in there. Yeah. Natasha says she watches YouTube videos on surgeries. I know, I do as well. And there's some out there which are really, really interesting. And it gives you a really good sense of what's actually happening during the surgeries. So with a simple mastectomy, all that they're doing is taking out the breast tissue, the skin, the nipple, and the areola. But maybe they'll take some of the fascia of pec major, but nothing with the actual muscle belly itself. And all the axillary lymph nodes are left in place. So that's why it's called a simple mastectomy. And it has been formed a little bit later on from some of the other types of surgery, because they started with the radical, which we went into in the history, and then a modified radical, and now they're at a simple, and they're like, oh, we don't actually even need to take this person's lymph nodes. We don't even need to take their pec major. We can just take the breast tissue, the skin, the nipple, the areola. Maybe the fascia needs to come off, but otherwise, that's all that we're taking. So this is a less invasive form, although it's still major. There's no way around it. So this is some scar presentation. This person here, she's got these oblique scars, and the style of scar, the direction it is based on where the tumor was related. So they'll try and do a horizontal scar or a crescent-shaped scar. Maybe they'll do flat all the way along the body. This person has oblique scars. But as you can see, what you see on the outside is just so small compared to what they do on the inside, because this whole area was on both sides was attended to in the surgery. Natasha asked, tram flap is the most invasive. Tram flap is a very invasive surgery. Absolutely. Yeah. And they have now a less invasive version, which is the DIEP flap, where they're not actually harvesting the muscle, but those are still some of the most invasive surgeries that are available now. So this is another presentation. This one's more of a horizontal line. I know when I see this patient, my fingers absolutely itch to get on this person and start doing fascial work around their scars, to do lymphatic work, to try and shift some of this fluid, try and get some elasticity through here. Probably she's had radiation and it's created to some of the shrinkage of the skin. So this is a person that you call this a flat closure, as opposed to reconstruction, where they're recreating the breast. So this person has a flat closure, and the scar presentation, as we mentioned, horizontal or oblique. And it's possible this is one stage on their journey, because they are getting delayed reconstruction. Just pop a yes in the chat if you know what delayed reconstruction means. Yes. So if any of you don't know, it means that they are not going to do the reconstruction right away. They're going to wait for the body to heal. Maybe the person's going to get radiation first. Maybe they're going to go through chemo first, and then they're going to get their reconstruction down the road. So this person knows this is just a stage on my healing experience, and I'm going to get something else later on. What we can do is we can help acclimate to the loss of breast, and we can do that by creating this healing intention for resilience, for well-being. And when we are able to hold that space, then it naturally can help the person overcome this vast change in their sense of body identity and help them acclimate to the loss of their breath. And we may need to hold space for grief and building trust with the patient that we are able to help them. So I'm a big believer in intentions. I came from energy healing before I ever got to massage therapy. And I really believe strongly in intentions. And I know that when we are working with people with a clear healing intention, it can create a much more profound result in the treatment than if we're not very mindful and we're not very aware. So this is gender affirming top surgery, female to male, otherwise known as body feminizing surgery, chest reduction, chest construction. Often people who are like trans men or non-binary people who are getting this surgery, they don't really like the terminology of mastectomy, even though technically they are getting a mastectomy, because it's a very female-centric term. And they may be comfortable with it. They may be like, yeah, it is what it is. But they may also prefer language like chest reduction because it just makes them feel not quite so female-centric. So there's a couple of different kinds. But what I'm going to show you here, this is called a double incision, where they're doing this horizontal line here. And then they're, oh, I'm just going to ask you to mute yourself, dear. Whoever was just clearing your throat. Thank you so much. So there's also a scar around the nipple and areolar complex because they had to reposition this person's nipple and areola to a different place. So this is a close-up here that you can see. And what's really interesting with this patient is that they're a mixed race individual. So they have more melanin in their skin. So they have a darker hue to their skin tone. And their nipples used to be dark. But after this surgery, they lost pigmentation in their nipples. And that has remained even 4 years later. So they now have pink nipples and dark areolas, which they're okay with. But, you know, it was a change. And it took a couple of years for their nipples to acclimatize. They had chronic infections and seeping and weeping for a couple of years. And now they're on top of it and all is well. There's another interesting thing here, which is where the erectile tissue disappeared on their right side. So the left side still has erectile tissue. The right side does not. And that is also a change that has remained. So, you know, people can go through a lot of different things, but this is one of the types of mastectomies that people can get when they are getting gender affirming top surgery. Now, we're also going to cover a breast reduction because this is another form of surgery. Sometimes people get this for medically indicated reasons, like my back is killing me. I'm in so much pain. I need to take some of the weight off my chest. Do any of you know someone who's had a breast reduction? Pop a yes in the chat if you know someone who's had a breast reduction. Yeah. So, you know, it's not uncommon for people to get breast reductions. If they're going to do it in a purely aesthetic way, then they may have to pay completely out of pocket, depending on which country they live in. But if it's for a medically indicated way, like I'm in so much pain, I can't actually function in life. In Canada, anyway, it can be covered under your provincial healthcare plan so that you don't actually have to pay for it in the state. I'm actually not 100% sure if there's an insurance option for medically indicated breast surgery. For those of you who are American, can you put in the chat whether breast reductions can be covered under insurance, if you know, if you are American. Okay, more things to find out. Depends on how good your insurance is. Yeah, isn't that always the case? So this person, I'm not sure what size breast she started out with, but what she finished with is probably still, I'm going to say a double D, which is still a healthy breast size, but for her, probably feels like, whoa, I'm on vacation. There's like nothing to haul around here. I got a light body that's like I can move around so easily. My clothes fit so much better. And, you know, she just probably feels a great sense of freedom that she didn't have before. But there's also another reason for getting a breast reduction, which is if somebody has a breast cancer surgery on one side and then they need to create some symmetry with the other side, then they can get a breast reduction on the non-cancerous side. So then they have two different surgeries that are happening. And that's one of the reasons why you need to know what's happening in the surgeries, because one person may be carrying multiple surgeries in one body. So what they're actually doing in a breast reduction is they're taking out a section of the breast to make it smaller. And what they focus on is this lower section of the breast. So they cut it away. So you can see here, they create this distinctive pattern and they cut it all away. It kind of creates this keyhole shape. And then they leave the stalk of the nipple in place. They don't have to detach it so that later on nipple sensation can return, which is really welcomed for most women. In breast cancer surgeries, often they remove the stalk of the nipple, so there's no chance of nipple sensation returning, which is a loss for a lot of people if their breasts are erogenous zones and then they don't have that anymore. They have to learn adaptive intimacy techniques, and you actually may be the person they bring that up to because they actually feel safe with you. Not that you're expected to give them any kind of solutions for that, but if they do bring it up, you can just hold space. And then, like we talked about yesterday with trauma-informed care, you may need to advocate for additional services, like they go see a therapist who specializes in sex therapy and adaptive intimacy and how they're able to create that, you know, pleasure experience in their body when they don't have the sensation in one of their erogenous zones anymore. Now, they take the nipple and areola and then they reposition it and then they sew it all together inside and out. They bring these two flaps together and it creates this kind of anchor shaped pattern. This is called a Weiss pattern, W-I-S-E, Weiss. And this is quite a classic breast surgery scar pattern here, Weiss scar pattern. So just a note in the chat here, I was told they have to remove a certain amount of weight grams for insurance to cover it. Right. Yeah. Weight loss, that's something that people often have to go through prior to the surgeries, and it would make sense. The insurance is like, we want you to be in the optimal state possible in order for you to receive this if it's going to be under our coverage. So let's talk about management. What can you actually do here? And there's some things you can do with different parts of the body that are very helpful. And there's some techniques which are our bread and butter, like Swedish massage. So stress management is one of the and these next four, they're not like in any particular order, but stress management is an incredibly important component of working with people going through these types of surgeries. And Swedish massage is been shown to decrease stress hormones like epinephrine, norepinephrine, and cortisol. So the person is less stressed. Now, just pop in the chat, what are some of the results? Just use a word. Some of the results that people have when their stress goes down. What happens inside their body when they have less stress? And you don't need to write out a paragraph, just throw a word or two in there. Some of the things, you know, people are not able to cope with life as effectively when they're super stressed out. Yep, lowers their blood pressure, pain reduction, deeper breathing, decreased muscle tension, they sleep better, pain relief, they're more productive. All these things are so important. Greater pain tolerance, sleeping better, improved healing. Yeah. So all these things are super, super, super important. This really influences quality of life and a person's ability to cope. Efficient digestion. Yeah, absolutely. Now, if someone is in an acute or early subacute stage and you're not actually able to work on their breast or chest area, then you can work with their hands and their feet. And you can do Swedish to their hands and their feet, and you can do a lot for stress and pain management. Very effective. Another area to manage is pain. Pain is a very real thing after surgery. Sometimes it's a normal surgical side effect. Sometimes it is a complication. Either way, massage has been shown to be a great non-pharmacological method of pain management. And one of the ways that we can work with the receptors in the body with light touch techniques are mechanoreceptors. Mechanoreceptors respond to light touch. They don't need a hammer. They transfer signals from the tendons, which are on the, outer edges of the muscle, and they send the signal through to the central nervous system, and they help to moderate pain signals. So you're able to say you're working with pec major, and I want you to just put your hands up onto your own sternum, and I want you to feel the borders of pec major where it attaches to your sternum. And I just want you to do some gentle fingertip kneading, nothing intense, nothing very deep. It doesn't have a lot of room before you're hitting bone there. And you can be working in this area very lightly, and you're accessing the mechanoreceptors. So this is a way that you can reduce the amount of pain and tension in the muscle belly without actually attending to the muscle belly itself. You can just attend to the tendon. So just pop a yes in the chat if that is something that you think you could bring into your practice. Yes. It's very effective. It's much easier on your hands, and it's easier for the body to integrate. All right. Another area to manage is mobility. So stress, pain, mobility. And one of the techniques that's shown to be super useful is myofascial massage. So it's been shown to be extremely useful for restoring upper limb mobility following breast cancer surgery. And, a lot of it is really you're creating slide and glide between all those layers of tissue, because if you remember from the surgery, they get very dried out, they get very adhered, and myofascial work helps to restore the fluid, the hyaluronan, it's such a tongue twister, that exists between the layers of fascia, especially the deep layers of fascia. And so if you can help promote that slide and glide between the layers of tissue, then it has an easier chance of being able to stretch and be mobile, and it doesn't have to burn your hands out. So mobility management, myofascial work is really useful for this. How many of you are fascial practitioners? Yes or no? Pop your yes or no in the chat. Some people do it. Some people are like, it's not my thing. Yeah. So a lot of you have myofascial massage, which is great. All right. Another area of pain management is scar tissue. You cannot divorce yourself from scar tissue work if you're going to be doing post-operative work. And one of the things that's really important with scar tissue is reducing tissue tension. So why is this useful? Why do you think reducing tissue tension is helpful? If you have less tissue tension, then it signals to the body, we don't need such a strong bridge. So we don't need as much collagen. We don't need to, overload the area with these reparative tissues because there's not as much tension that's pulling it apart. So you can do a lot to reduce the volume of scar tissue that's being laid down if you can reduce the amount of tension in the surrounding area and also in the scar itself. Yeah. So yeah, there's a note here, pulling, it probably lays down less scar tissue. Absolutely. Decreases pain for the client. Absolutely. So what our ultimate goal is we want a smaller and more pliable scar. So if you're helping to reduce tissue tension, then you can create that smaller and more pliable scar. All right. Before we get into the science of mentorship, are there any questions about what we have gone over so far? Anyone who wants to put your voice into the circle? Juliana, let's bring you up here.
I just I would like to know if you also work with implants as well, for the silicone as well. That's also part of it, right?
Yeah, absolutely. Yeah, implants are a very large part of breast reconstruction. Sometimes people get the breast reconstructed with their own body, but often it's with their a foreign object like an implant. So yeah, getting familiar with how those are placed, what support systems are present inside the body to hold it in place. That's all really important. Yeah, for sure. Thank you. Okay, so let's go into the science of mentorship because I think this is really interesting. And, you know, my goal is to help you learn. And I was really curious. This is one of the rabbit holes I ran down over a period of time. What does science actually say about mentorship? This is not scientific. I just think this is interesting. A mentor is someone who sees more talent and ability within you than you see in yourself and helps to bring it out of you. And I certainly know that with the people that come into my classes, that I see they have a lot of capacity and sometimes they don't have confidence, they're not sure. And so then they can borrow some of my confidence that I see for them until they have their own confidence and are able to run on their own with it. So one of the things I think is super interesting is your critical thinking skills are increased when you are with a mentor. That means you're able to do some creative problem solving more effectively. You've got better communication skills, so you can talk things out more effectively, and you can work with other people more effectively. So all of these things go together to create a better outcome and a better result. And, you know, interdisciplinary work, that's the future. We're not going to be in silos forever. We're going to be working with other people in other disciplines. And so if we can collaborate with other people, we can speak about what we're doing, we can listen to them, we can problem solve, we can critically think. All of that enhances our ability to offer patient-centric care. We can create stronger professional relationships with our mentor, with each other, within community. And I love this because it's been shown mentorship does create solutions for global health challenges. And do you think, pop a yes in the chat, if you think breast cancer is a global health challenge? Is this something that people all over the world are experiencing? You bet. It is everywhere. And this lack of follow-up care, unfortunately, is quite common in a lot of places of the world. And it's something that really needs to be fixed. We do not need to be leaving women in long-term chronic pain, in body dysmorphia, in movement issues, just because people have not figured out a way to offer the support. And if you're working with a mentor, you can be part of the solution for these global health challenges. And I would love to invite you in to be a part of that solution. Now, how many of you are rural healthcare professionals? Pop a yes in the chat if you live in a rural location. You're not urban dwellers, you are country dwellers. How many of you are in the room, rural healthcare professionals? Yeah, a couple of you. Okay. So there's some pretty interesting science around rural healthcare professionals. And the burnout rate is really high with healthcare professionals living in rural environments. But when you're working with a mentor, things get a lot better. The burnout rate goes down There is a greater sense of belonging, which is really important because people can feel isolated when they don't have as many people around them. But when they're working with a mentor, they have a greater sense of belonging. There's greater career optimism. So people are not getting fed up and feeling like, I'm in a dead end road. I can't go anywhere. I can't do anything. I'm stuck in the same thing and not feeling very optimistic about my future. When you're working with a mentor, it's been shown career optimism does increase, as well as job security. This is super, super important for all of us. Greater clinical competency, right? We want to know what we're doing is useful, that we're good therapists, and that we're able to create positive change with our patients, right? Pop a yes in the chat if you want to help create positive change with your patients. I know I do. It's one of the reasons that I started getting into this work, because I was like, we got to know how to do this work. We got to know what we're doing. It offers increased professional growth so that you're able to move past your boundaries, and you can have an increased connection with your surrounding rural community, and also healthier professional boundaries. Now, if you're in a rural area, you'll know you might see your patient in your practice area, whether you're at home or in a clinic, wherever you practice. Maybe you're in a spa, you see them there, and then you see them in the grocery store, and then you see them at the PTA meeting, and then you see them at the Little League game, and you see them at the barbecue cookout. And, you need some boundaries around all that, because you're running a lot of dual relationships. And when you are working with a mentor, it helps you establish healthier professional boundaries so that you're not getting burnt out and you're not bleeding yourself out all over the world trying to help people. You're actually retaining some of your energy for yourself. So if retaining energy, establishing healthy boundaries is something that you need to work with, pop a yes in the chat. And there's no shame. Again, honesty is a prerequisite for growth. And many people who are helpers help at the expense of themselves. Do you find yourself doing that? Pop a yes in the chat if you find yourself sometimes helping at the expense of yourself. I know I used to, and I've had to work hard to put some boundaries in place because I'm a natural empath, and it took me a long time to figure out what's mine and what's another person. And, that's part of personal growth and learning. Now, I also went down, here's one. This is our Academy member. She lives in a rural community, and I liked what she had to say about this. She said, there's no resources like this around here, and she's excited to be the person who's doing this work so she can be the go-to person in her area. And it's going to help her distinguish herself from the other massage therapists around there as well. So that's something that's a boon in your pocket. If you're not just a generalist anymore, you've got a special skill set. People are able to come and see you. You can get known for doing this type of work. Now, this is another thing that I really love, is supporting culture and gender. And it has been shown when people are involved in mentorship programs that there is greater inclusivity in their workplace, in their mindset, in their approach to life. There is increased diversity, equity, and resiliency. And I think resiliency is one of the main things that we are doing in this practice. So mentorship really has a lot of benefits. So now I want to ask you, when you're projecting ahead, where do you want to be a year from now? And if you're thinking about mentorship, I just want you to keep it in the back of your mind if you think mentorship could help you with any of these goals and visions that you have for yourself a year from now. So I'm going to want you to pop your number in the chat if there is one that suits you particularly here. So are you interested in finding a new place to work? Where you are right now, it's like, it's okay, it's kind of doing the thing, but really you'd like to get out of it. And you want to start opening yourself to a new place. Maybe you want to change your clinic. Maybe you want a home-based clinic. Maybe you've been working in a spa, but you actually want to work in an interdisciplinary clinic. Is a new place to work of interest to you a year from now? How about pain in your hands and your body? Is this something that is of interest to you, that you feel like, maybe I'm carrying more soreness than I need to? Maybe I want to be able to I want to make some change in how I work, and so I'm not feeling as much pain. Do you want to be cultivating a lighter touch for your career longevity? Maybe you're a deep tissue therapist and you're like, if I want to do this over the long term, then I'm going to need to feel like uh, I'm I'm not using my hands in such an intense way, and then I'll be able to get more years out of my practice. Do you want to feel like you have more autonomy over your practice? Is this something that is important to you? Are you working in a place right now where you're like, oh, I don't really get to choose the people that I work with, or I want to be able to have more say in how I do my practice? Maybe you're able to work more with your desired clientele. Maybe you want to devote a portion of your practice to breast and chest clients. And you want to say you want to devote 50% of your practice to this clientele, or 1 day a week, maybe 25% of your clientele, or however you do it. How about refreshing your schedule so you're not seeing the same people over and over again for maintenance treatments? I know when I was a generalist, I had people who would park themselves on my table week in, week out, month in, month out for maintenance treatments. And I was like, pretty darn bored. I was like, this is not satisfying. Yeah. You know, it's like if you're a landscaper and then you're just stuck mowing the lawn forever and you don't really get to, do all the tree trimming and bush trimming and all the loveliness that you can create out of the garden. Instead, you're just stuck doing the same lawn mowing all over again. So if you want to make change, I also want to know what is stopping you. And I want you to put your number in the chat here on some of the things that might be stopping you at the moment. First of all, if any amount of knowledge is one of the things that is stopping you from making the changes that you want, scar tissue, surgeries, complications, stages of healing, new research, oncology, gender affirming care, anything in that area, if knowledge is stopping you, then just pop a 1 in the chat. Maybe marketing. You don't know how to bring clients into your practice. You don't have the income that you're looking for. You don't know how to move from being a generalist. You don't know how to communicate about what you're doing so that people know you're safe and ethical. Like, you don't want to put yourself out there and have people think like, why does this woman want to work on my breast? Is there something going on here that I don't know? And you're like, no, it's all above board. I just don't actually know how to talk about it. I don't actually know how to bring these people into my practice. What about imposter syndrome? You're not sure really what you're doing. You really don't like to wing it. Maybe you've got low confidence and you don't want to take the long trial and error approach. And you're like, I really would rather feel like I know what I'm doing and like I'm not an imposter. Hands-on practice. You're just not getting as many people as you would like to be able to gain the clinical skills that you are looking for. Hands-on practice is a thing for you. Pop your 4 in the chat. And finally, connection. Maybe you don't know how to reach out to the world around you to create those referral relationships. Maybe you're not sure how to reach out to the doctors or other healthcare professionals or the Two-Spirit LGBTQIA+ community. Maybe you're like, I could use some help with that. So if that's the case, I have an opportunity for you that I would love to introduce you to. And it is a way for you to get knowledge, hands-on practice, understand marketing, language, supportive network, knowing you're not going to hurt anyone. This is the Mentorship and Training Academy. I mentioned it yesterday, and it's all around breast, chest, and oncology massage. So it is a 200-hour program. It's over 6 months, and it starts on September the 14th. And you're going to see a whole bunch of pictures of different events that we've done over the years now coming up. So these are all MG therapists. And this program really is something to jump about. It's got a lot of very wonderful components that I'm excited to share with you. So first of all, it is accredited massage training. So it is trustworthy. It is worthwhile. It does get you hands-on practice with real breast and chest surgery patients. It does cover marketing and communication so that you can bring these clients into your practice. And this is a direct outgrowth of people taking my weekend courses and being like, amazing course, no idea how to get these patients into my practice. So now, under the guidance of a mentor and within a supportive community, you can do that. So this is what one of our people said. She was looking for a program like this for over a decade, and it's exactly what she needed in order to move forward. It's full of people who care about what you do. It truly is a supportive community to help accelerate your growth. We do help you build community relations with groups and healthcare professionals, and we do provide assistance for you reaching out to surgeons and doctors. And this is kind of long, so I won't read the whole thing, but it's going into the supportive community where we can celebrate and encourage each other, and carrying this vibe of, if I can help you succeed, we all succeed, which I think is really, really important. So if you're one of those therapists who feel like you've been a dabbler, you're lost and fumbling, and you need a place to land, this is a really good place to land. Now, because we live in the modern world, you do need flexible learning and growth, and we have various different ways of doing that. And one of them is in your hand skills and your mindful care. So you do get practice sessions with personalized video review, so you can actually see, I can see what you're doing, and I can give you feedback like, oh, this part's really strong, this part could be strengthened, this scar tissue work could slow down, you know, this circulatory work would be more effective over in this area. I can actually give you that type of feedback because I get to actually see what you're doing. And you probably haven't had that since you were actually in school. Now, a midway review is, which we just conducted with our Academy members, is halfway through the program. There is an average of 5 new practice people that our Academy members have gotten, and 16 hours of hands-on practice. So they still have the rest of the program to go, half the program to go, but they're already averaging about 16 hands-on hours. So about 30 of those hours going forward will be getting their hands on actual patients, which is great. The classes are virtual, and they're a combination between live and self-paced. So the classes are all live. There's this instructional video library. There's class recordings. There's templates, which I'll go into in a moment. Lots of research articles, lots of surgical videos, and you know, you get to learn in a modern way because we're living in a modern world. I do believe in multiple layers of support. So we do go into one-on-one mentorship where you get time with me to talk over what you're going through. We have group coaching, we have accountability buddies, and we have a private community just for people who are in the Academy. So you can message back and forth and get to know people inside the Academy. And I do honor 5 different learning styles in every course because people learn in a different way. And just, you know, pop a yes in the chat if you've ever been in a class where you're like, this is not the way that I learn. I'm much more of a visual learner, or I'm a doer. I learn better by doing, or I learn better by talking it out with people. So we honor all those different learning styles. So we go through visual, auditory, which is listening, kinesthetic, which is body exercises, written, because that's helpful for retaining information, and social, where you get to discuss things. So we switch it up. It's certainly not the same thing all the time, and it really helps with that flexible learning. So in terms of the core curriculum, we got different levels. This is the foundations, where you go into all the breast surgery basics and how to do ethical and professional breast massage. So you get your language for treating sensitive areas, working with the different populations, your treatment protocols, how to enter treatment, exit a treatment, how to drape, how to do your mindful care, how to do your assessment, your charting, and your hand skills for basic therapeutic breast massage. And it tees you up really well to understand how to work with 18 different types of breast and chest surgery, which you get in level 1. So many of them are breast cancer, but some of them are gender affirming or elective. And then level 2 is where we go into when things, you know, get complicated. And you need to know, this is what really turns you into a safe therapist. You know, if you want to feel like a safe therapist, this is vital information for you to know, because then you know, I'm not going to be hurting anybody. I understand what complications are. I understand how to reduce them. And our goal across North America is to get the complication rate down from 30% to whatever lower number we can do. The lowest, the better. And if you want to be a part of that, I would invite you in to help reduce that number. We also go into integrative cancer care so that you're able to work safely with people going through chemo and radiation. And we also give you workshops because you need to know how to be able to reach out to the world around you. So we've got super good workshops that are done by massage therapists for massage therapists so that you understand how to communicate with the world around you about what you are doing. There's a ton of different templates. I'm not going to go into all the templates, but you get ones for your massage practice. You get ones for marketing and communication, including your business cards, your brochures, your social media posts, letters of introduction. I'll go into that in a moment because you need to introduce yourself to the world around you. And so we give you templates like, hi, my name is Sonia, and I am a local massage therapist in your area. I would love to be able to come in and, have a coffee with you or have a Zoom meeting. And we give you language for the different types of people that you're going to be introducing yourself to. In terms of the schedule, it's mostly on Mondays, some Saturdays, and there's one Sunday in there. And you want to think about approximately 8 hours a week. So the training calls are 6 hours. So that would be in 1 week, that's your major activity, maybe a couple of hours of some review, or maybe you do a little bit of marketing. On the weeks that we have the group mentorship calls, they're a shorter call. So maybe on that week, you do your practice sessions. And, overall, it ends up being a fairly digestible amount. You do have to make some room in your schedule for it because it's a 200-hour program, but it teaches you everything you need to know. So if you value professional development, this is for you. Growth matters. Up-leveling your skills and your knowledge matters. Pop a yes in the chat if any of this is important to you. A strong and supportive community bringing you joy and confidence. If this is something you feel like, I want to be a part of it, I want to be a part of the solution, you want to help to fill a massive gap in healthcare that women and gender diverse folks are going into, just pop a yes in the chat. We need more people who are a part of the solution, and I want to invite you in. Also, you might want to find more meaning and purpose in your practice. Maybe you're feeling a bit bored or burnt out, and you're like, I need to be doing something that means something more than what I'm doing at the moment. So let's talk a little bit on return on investment. This is important because I know if you're like me, you are a savvy shopper. You don't waste money on things, and you want to make sure that you're actually getting a return on your investment. Sonia, is it accredited in the US? Yeah, the comprehensive training, which is the core curriculum, we are super, super close. We're in the final stages of being approved with the national body. It's a lot of letters that I always get mixed up, in MCB, TCB, or whatever it is. We're really right on the verge of that, so you'll be able to get accredited for that. So you do have the ability to raise your rates upon graduation, which is something that is really helpful. So let's run through a little scenario here. You can add $20 per treatment. And if you were to do that and you were doing 5 treatments a day, that could lead to an extra $100 a day above and beyond what you can earn as a generalist. If you're working 2 days a week, it's an extra $200 a week, an extra $800 a month, $8,800 a year. So just ask yourself, if you were having an extra $8,800 a year, what could you do with that? Would you help your kids in their sports? Would you go on vacation? Would you put it into savings? What would you do with an extra $8,800 a year? You could earn your investment back within 6 months, which is an incredible rate. And you could double your investment within a year. So although it's a little bit of an investment up front, you have a great earning capacity. And especially you can add years to your earning potential. So if you're feeling like you want another decade to work, you could get really almost an extra 100 grand above and beyond what you would earn as a generalist. So it's something that can bring money into your pocket. It can save your body. It can save your mind. It can introduce you to a beautiful population. And if you want to really make change in your professional development, together is the fastest way to do it. It's definitely faster to go together than to go alone. So I do want to invite you in. If you feel like this is a good opportunity for you, then I want to invite you to a clarity call. And here is a 30-minute call one-on-one with me, where we can create your mini plan to help you achieve your professional goals within a year. So I get to know you, where you're at in your practice, what you want out of your future, your goals, and any gaps you might have, and how our training systems can help you. So if you're familiar with QR codes, just hold up your phone and scan this QR code. It's going to take you directly to my booking calendar. I've got times starting on Friday, and over the weekend, I've opened up a certain number of calls. It is for come, first serve basis. And if you're feeling the call, if you're feeling like this is something that I want to do, then you are able to discuss all that in the call. And I'll go into the specific cost of the program there, because there's different pay structures and different bonuses that are available. So if you do sign up for the Academy from the call, there are significant savings when you sign up from our Clarity call. There is a special VIP day where you get an extra 3-hour group session prior to the Academy start. You get an extra video review, so you get more feedback on your practice sessions. And also you get a home care short course where you can see techniques for helping patients prepare for surgery and regaining their movement afterwards from home. So again, here is your QR code to book your Clarity call. And I'm just going to invite you to find your time. And we're at our time now, but I've got a couple extra minutes I can stay on if anyone has any questions. All right, so just let me know, how are you feeling now? What's your emotion that you're feeling after today? What science says, learning about your training opportunities, what is your word for today? Pop it in the chat. Yeah, encouraged, amazing. Is there a voice recording available after this class and yesterday's? Yes, yesterday's was emailed out, and today's will be as well. Pam is feeling thoughtful and excited. Science is wow, absolutely. Optimistic, amazing. Excited, amazing. Okay, this is terrific. Well, I really want to thank you for your time and attention today. It's been super interesting engaging with you, hearing your questions, reading your comments. I really value your time. Tomorrow, we're going into some hand skills so that you're going to have techniques with mindful touch, with light touch treatments that you are able to apply to your patients. And also, you're going to get an experience, of self-breast massage. So show up tomorrow somewhere where you can do that privately. And same time, same Zoom link. We will see you here tomorrow. All right. Thank you so much. Ciao for now. Bye.